Yes guys, welcome back to my second video of my Cove Interview Medicine series. Was not feeling that dead white t-shirt. Had to whip out the nice blue scrubs, show that I'm an actual med student. So you guys might have watched my previous video, but if you haven't, it was about answering the question of why medicine. And sometimes in interviews, the interviewer will follow up that question with a question about why you chose to do medicine and not any other healthcare career, such as nursing, HCA, PA, or all the other ones out there. So the reason they ask this question is to sort of probe your understanding of other healthcare professionals and their roles in the multidisciplinary team. And if you do get asked this question, then it's a good thing you watch this video, because I'm going to be breaking down how to effectively answer this question. So before we even think about answering the question itself, I think there's a bit of base knowledge that you guys should know, and I'm just going to cover this briefly before we move on to the bulk of the question itself. And the first point is that healthcare professionals, whether they be doctors, HCAs, nurses, whatever it may be, they often display quite similar characteristics and qualities in terms of empathy, teamwork, excellent communication skills, and these aren't qualities that are unique to doctors. So I'd say try and avoid using these as part of your answer as to why you picked medicine, because at the end of the day, no matter which field of healthcare you go into, you're looking after patients, and no matter what your role may be in caring for that patient, there are those general sort of themes that all healthcare professionals should display. Now moving on to the second point, I'm sure you guys are aware that there's a bit of a shortage of doctors right now in the UK, and what this means is that the scope of practice of other healthcare professionals is ever expanding. So I don't know if you guys know this, but advanced nurse practitioners can actually examine patients. They can order blood tests and imaging, and traditionally you'd think only doctors can do that stuff, but nowadays there is a lot more overlap between the roles of healthcare professionals. So you're probably thinking, like, how does that differ from being a doctor? Because isn't that what doctors do? But there is a key difference, and that is that advanced nurse practitioners have very strict protocols to follow, and they don't have that freedom of critical thinking and making decisions based on their expertise and knowledge. And so they're almost forced to always stick to the protocol. But yeah, when it comes to actually answering the question itself, my first tip is to just praise nurses, because nurses do an absolutely incredible job in the NHS. And honestly, I mean this, but without them, the NHS would completely crumble. So, I'd say the first thing is really good to just get out there your appreciation for nurses and show that, you understand just how important their role is in the care of patients and, sort of the functioning of the NHS as a whole. And also guys, I'd say really try and show that you understand the multidisciplinary team side of things and how everyone works together and how everyone has a specific role in the team and how this all contributes to the overall care of a patient. Because at the end of the day, it's not about one role being better than the other, it's all about the different roles and responsibilities coming together. So when you guys are explaining this, try and throw in a couple of similarities between the roles of doctors and nurses, such as the fact that both have that intimate contact with patients, and also there's that clinical side of things where both roles might do bloods and do certain investigations. So highlighting these similarities will really sort of show your understanding of nursing. And you can also throw in a few of the things that you may have seen on your work experience, just to sort of make your answers a bit more personal. But similarities aside, there are some very key differences that differentiate the roles of a doctor and a nurse, and this should actually make up the bulk of your answer to this question. So you really want to make sure that you prepare your points for this really well. So some key differences between the roles are that a doctor has the ultimate responsibility over a patient. At the end of the day, although both professions have a huge role in the care of the patient, it is the doctor that has the final say on the diagnosis of the patient, the treatment and management. So this extra responsibility is a big part of being a doctor, and it's what really sort of separates doctors from other healthcare professionals. Not to say that other healthcare professionals don't have high levels of responsibility, but if something goes wrong with the patient, it's probably going to be the doctor that gets sued for it. So when you make this point of the heightened responsibility that doctors have, you know, you could elaborate it further by saying how you thrive in positions of high responsibility, and also how you feel like you can adapt well under pressure. And this was actually one of the points that I prepared for my interviews. So another reason you guys can give as to why you want to be a doctor and not any other healthcare professional is the fact that doctors can do surgery, and you know, this leads to more hands-on sort of, don't know why I'm doing this, but it can lead to more sort of hands-on procedures. And you know, it's only doctors that can join the Royal College of Surgeons. And you know, if you're someone who has a real practical side to them and you enjoy hands-on learning and, you know, doing complex things, then surgery might be the thing for you. And you could actually mention this in your interview, that you might want to be a surgeon, or that you might want to take part in complex operations that only doctors might be able to do. So another key difference between doctors and other healthcare professionals is that as doctors, you have a lot more of a general training path. And what that means is you'll be exposed to so many different specialties, you know, whether that be cardiology, resp, neuro, endocrine, you know, there's so many out there. And that's one of the things that really drew me to medicine, is the fact that there's so many different career paths after I graduate. Whereas as a nurse or any other healthcare professional, there's fewer sort of options in terms of the specialties that you could go into. So that's something that you could mention in your answer, especially if you have a specialty that you're super keen on, or even if you don't, you could just say how you'd love to explore the various different specialties at med school, and that you feel as though you'd have greater optionality if you did a medical degree compared to a nursing or any other healthcare degree. So just before I wrap up this video, I'm going to go over some common pitfalls to this question. And the first one is actually not educating yourself enough about the roles of various other healthcare professionals. So, you know, you do not have to know in intricate detail the day-to-day activities of a nurse or a healthcare assistant. Like, you know, you don't need to know that much detail. Just know the basics of the role and how that fits into the multidisciplinary team. And you know, just make sure you educate yourself, because it really doesn't take that long. Just takes a quick Google search if you're not sure. So yeah, don't fall for that one. Another one is don't undermine nurses and say something stupid like, you know, doctors have better career prospects. Like, that's completely not true. Like, I'm sure there's a lot of nurses out there who are making a lot more bank than doctors are. So, you know, don't say something stupid like that. Another one is like, don't say that being a doctor is more interesting, because imagine your interview as a nurse, like that can actually happen. So yeah, you don't want to piss that person off. And the final one is try not to be too dismissive of other healthcare careers, because you are going to be working with these professionals in the future. So it's really important that you remain respectful and that you try and answer your question in a diplomatic way, because like I said, your interviewer might be another healthcare professional, like it might be a nurse or a healthcare assistant. And also, because there's so much overlap between the roles of healthcare professionals, you don't want to be showing too much favoritism, because that would actually be really dismissive. So that is it for today, guys. I hope you guys found this video useful in helping you guys prepare your answer for that question of why medicine and not any other healthcare profession. If you guys want me to cover any specific interview questions, then just drop them down below in the comments and I'll try my very best to make that video for you guys. And listen, if you guys find these videos useful, then share them with your friends and your peers, because I'm a firm believer that, you know, having that whole team winning mentality can bless you in ways that you can't even imagine. So really try and help each other out, because at the end of the day, you're all in the same boat and you're all going through the same nerves and the same anxiety surrounding interviews. So like I said, share it with your friends and peers, and you know the drill by now. Subscribe, drop a cheeky thumbs up if you enjoyed the video. I hope to catch you guys in the next one. Peace.